Good morning, everyone, and thank you for coming to our press conference today. My name is Jamie Peddle, and these are my colleagues Sarah Ruth and Andrew Kavchak. I am from Brampton. Sarah is a Canadian who moved from Niagara to Buffalo, New York, and Andrew is from Ottawa. We are all parents of children who have been diagnosed with autism and who are severely affected by the disorder. We are founding members of the Canadian Autism Treatment for Medicare Coalition, and you can find us on our coalition page on Facebook. We are here today to call on the federal government to stop dragging their heels with respect to the development of a national autism strategy and to quickly move to implement a meaningful strategy that would include two components that are critical for families who have children that are severely affected by autism. Such a meaningful national autism strategy should include, first, steps to ensure that autism treatment for newly diagnosed children is delivered through healthcare with Medicare coverage right across Canada in accordance with national service standards. And second, steps to ensure an increase in the number of group homes for adults with autism who are unable to live without care and supervision. I am a single father of 4 children. The youngest is an 11-year-old boy with severe autism who needs medically necessary autism treatment. The treatment is intensive behavior intervention therapy based on the principles of applied behavior analysis known as ABA. The medical and scientific communities have known since the 1980s that ABA is effective evidence-based treatment for autism. Studies and experience have demonstrated that ABA can have a huge impact on the development of children who are diagnosed with autism. Until the cause and cure of autism are discovered or a more effective treatment is found, ABA is the core healthcare need of children diagnosed with autism. Over the years, many provinces have launched ABA autism treatment programs. Ontario's program was launched in 2000. However, the program was not treated as a medically necessary health service to be delivered through the Ministry of Health with OHIP coverage. Instead, as in so many other provinces, the ABA autism treatment program was assigned to the Ministry of Social Services. This is a fundamental error in public administration and program delivery. The department that administers welfare does not have the healthcare expertise or the resources to do the job. Since inception, the Ontario program has been plagued with unconscionable waiting lists. Over the past 2 decades, the Ontario program has been routinely subject to tinkering by the provincial government, and today the program is in shambles. In 2019, there were 24,000 kids on the waiting list for treatment. The Government of Ontario then announced a revamping of the program, and today there are over 60,000 on the waiting list. Because ABA is not covered by Medicare, the cost of providing medically necessary treatment has often fallen to the parents who are forced to resort to the private sector. The consequences are that many of our children are not receiving treatment because of their family's inability to pay. This is not only un-Canadian, it is immoral. The Public Health Agency of Canada issued a report in 2019 indicating that the prevalence rate of autism was 1 in 50. Just last month, the American Centers for Disease Control issued a report stating that the prevalence rate is now 1 in 36. More and more kids are going to be added to the wait list that will continue to get longer unless something is done. The federal government owns the Canada Health Act and provides healthcare funding to the provinces through the Canada Health Transfer. The federal and the provincial governments have routinely negotiated health accords with federal funding specifically tagged for certain healthcare services. Yet these negotiated deals never include any funding targeted for autism treatment. The federal government is introducing pharmacare, dental care, a national child care program. What about autism care? In 2007, the Senate of Canada issued a report called Pay now or pay later. Autism families in crisis. The report called for the federal government to negotiate with the provinces a funding formula for autism treatment. The recommendation was ignored. Over 2,200 Liberal Party delegates at the party national convention in Winnipeg in 2016 overwhelmingly voted to pass this resolution calling for Medicare coverage for autism treatment. This resolution clearly lays out the roadmap of how to solve this issue. Just like the Senate recommendation, the federal government ignored this resolution, and that's why we're speaking out. In 2019, Prime Minister Trudeau said the government would develop and implement a national autism strategy. Here we are in 2023, and there is still no national autism strategy. Recently, my colleague Andrew Kavchak and I had a Zoom meeting with 3 officials from the Public Health Agency of Canada. When we asked them about the status of the National Autism Strategy file, they informed us that they were doing consultations and still working on it. They could not give us any indication of when we may expect something to be announced. Parents like us have been waiting for the federal government to take leadership role in this file since the Otten case was decided by the Supreme Court of Canada in 2004. It's been 20 years. Enough is enough. We are calling for the federal government to convene a meeting with the provinces, put some money on the table along with other incentives, and negotiate a funding formula to ensure improved access to autism treatment for children who need it through health care with Medicare coverage to be delivered in accordance with national service standards. We need Medicare for autism now. Thank you. I now invite Andrew Kavchak to speak.
Thank you, Jamie. Good morning, everyone. My name is Andrew Kavchak. I live in Ottawa, and I am the parent of a nonverbal 22-year-old young man who is severely affected by autism. My son needs supervision and care 24/7. There's going to come a time when my wife and I will be too old and frail to take care of him. When my son turned 18, we had his name added to a waiting list at the Provincial Ministry of Social Services for placement in a group home. However, there are so few group homes in Eastern Ontario that whenever a place in a group home becomes available, priority is given to families in crisis, where the parents are either too old, too sick, or dead, and unable to care for their disabled child. We were told that the average waiting period was 10 years. Believe it or not, there are some parents in their 80s who still care for their disabled children at home because there are no group home places available. Earlier this month, the Toronto media reported another case of a 23-year-old with autism who has been kept in a psychiatric hospital for the past 8 months because there is no other place for him. And the provincial ombudsman has launched yet another investigation. In a G7 country as developed and wealthy as Canada, is this the best that we can do for the weakest and most vulnerable citizens in our country? Since Prime Minister Trudeau announced in 2019 that his government would develop and implement a national autism strategy, the government has embarked on an endless series of consultations that have so far led us nowhere. In 2020, the federal government announced a spending of over $1.5 million and giving the Canadian Academy of Health Sciences, the CAHS, a mandate to conduct consultations along with a literature review. The government indicated at that time that the consultations would be broad and inclusive, and that all voices and interests would be heard and factored into the recommendations. Many parents of children who are severely affected by autism, including Jamie and I, made submissions calling for the federal government to help improve access to autism treatment. We suggested that the federal government provide incentives to the provinces to take the necessary steps to have autism treatment transferred from the Ministries of Social Services to healthcare, and for the treatment to be covered by Medicare and delivered pursuant to national service standards. My submission also pleaded for the government to address the severe shortage of group home places. The CHS report was released in May 2022. In its 412 pages, the issue of whether or not autism treatment should be delivered through healthcare, the healthcare system, and provided Medicare coverage was not addressed. Regarding the lack of group homes, I did a word search, and the words group home only appeared 3 times, and those were in a tangential fashion. However, the most disturbing feature of the CHS report was that it effectively, in our opinion, sugar-coated autism. The American Psychiatric Association's Manual of Disorders refers to autism as autism spectrum disorder. There is a spectrum, and the manual recognizes 3 different severity levels. Some people with autism are only slightly affected by the disorder and are high functioning. They can communicate very well and live independently. Others, at the other end of the spectrum, are severely affected and low functioning. They require help in every daily task, including toileting, clothing, eating, particularly if they did not have access to treatment and acquire the corresponding skills. The CHS indicated that they did not believe autism should be described as a disorder, and instead they used a neurodiversity lens to focus on autism strengths. While this may be appropriate as an approach for the high functioning who have plenty of strengths, it does not reflect the reality of those who are severely affected by autism. Although the government said in 2020 that all voices would be factored into the recommendations, the report astonishingly did not contain one single recommendation. As a taxpayer and a member of the autism community who has been waiting for some action for a long time, that consultation exercise and report was a disappointment. From our perspective, our voices and input were ignored, and it seems to us that the CHS report marginalized the plight of the severely affected and their families. Following the issuance of the CHS report a year ago, the Public Health Agency of Canada continued to conduct consultations with stakeholders and has held a 2-day national Zoom consultation conference last November. Since then, there's been no indication about the next steps in the process or when the strategy is expected to be announced. However, things have now gotten more complicated. Bill S-203 received royal assent on March 30th. The bill requires the government to develop an autism framework. We applaud the effort to put in law a requirement for the federal government to take some action. However, the first thing the Act requires the government to do in the first year following the passage of the Act is to hold another autism conference and to do more consultations. Notwithstanding the fact that we just went through a huge consultation exercise and just had a national conference, the government has now set things up in such a way as to extend the consultation festival so that it is unlikely we will see any autism strategy before the end of 2024. Many of us parents in the autism community who have been lobbying, advocating, and pleading with the federal government to get involved in the autism file have been suffering from consultation fatigue for years. And we are absolutely fed up with these endless consultations. We would prefer the government to copy the process it pursued with respect to its national dementia strategy. In its first mandate, the government passed a bill requiring it to develop a national dementia strategy. It did so in short order, and its budget allocated tens of millions of dollars towards the strategy's implementation before the strategy was even made public. Why won't the federal government act with a similar sense of urgency to help Canadians with autism? We believed Prime Minister Trudeau when he said in 2019 that his government would develop and implement a national autism strategy. We have waited a long time, and we call on the government to announce its autism strategy and implementation timetable now. We need Medicare for autism and group home housing now. I'll now pass the microphone to Sarah Ruth.
Thank you so much, Andrew. Good morning, everyone. My name is Sarah Ruth, and I'd like to thank you for allowing me the opportunity to speak to you today about something that is very important to me. I was born and raised in Niagara Falls, Ontario, but moved to Buffalo, New York with my husband some years ago. We have 2 children, Aiden and Zachary. Zachary was diagnosed with autism just before his 3rd birthday. When Zach was little, he struggled in every facet of life. He had 0 communication skills, which led to frustration, screaming, and self-harming behaviors. He lacked danger awareness and was known to elope or run away from his parents and caregivers any chance he had. And like many on the autism spectrum, was drawn to water. So we had to take extreme measures to ensure that he could not get out of our home or get away from us in public for fear that he would drown. Thankfully for Zach, he lives in New York State. So when I realized around 2 years old that he was not developing in a typical manner, I, as his parent, was able to make a self-referral for early intervention, evaluation, and therapy services, speech therapy, occupational therapy, physical therapy. Within a few months of my initial intake phone call, Zach had been evaluated and granted preliminary therapy services. Within a few more months, his therapist had enough data to increase his services. All of this predates his autism diagnosis. Upon receiving his diagnosis, his needs-based therapy increased, and ABA therapy was added 15 and then 20 hours per week. Within a matter of weeks, we saw massive progress. Zach was learning all kinds of new skills, many different ways he could communicate his needs with us. All of these therapies happened in my home, provided by traveling therapists, where I too received an education on how to better support Zach in his unique needs. At 4, he went to a specialized autism preschool and continued with his therapies, and by kindergarten, he was returned back to our school district with his peers. Was able to integrate and was also able to move back into a small, self-contained special education class when it was determined that was the best way for him to learn. Zach is 12, almost 13 years old now, and it's clear the amount of skills he's been able to gain that he will more than likely be able to live independently with some supports in place as an adult. New York State now also provides for a yearly budget of $50,000 per year per individual to assist with hiring support staff. This will allow Zachary the dignity of living independently when he is ready one day. Without the therapy he's received, he would have one day required a group home or specialized treatment facility to care for him when his father and I are no longer able. For decades now, Canada as a country has continued to pass the buck and do nothing to help families of children and adults with autism. It is absolutely shameful that a country like ours continues to be one of the worst in the developed world for autism services. How you treat your most vulnerable citizens is a testament of morals and values, and frankly, you're failing. Canada as a nation cannot afford to sit idly by doing little to nothing to support children while simultaneously doing nothing about the shortage of group home beds available for adults who can no longer be supported by their aging parents. I understand that the price tag of early intervention is shocking. Zach's therapy at age 3 and 4 costs somewhere in the market of $100,000 per year in US dollars. As he grows and learns and requires less and less supports, that number continues to decline. But I assure you that the cost of housing someone in a group home or treatment facility for several decades is far more shocking, and it continues to go up in cost as the years go on. The reason New York State offers the level of needs-based therapy they do is because statistically speaking, it will cost the government 2/3 less over Zach's lifetime to support him in this way. I am begging the government of Canada to stop talking about what they're going to do and finally take action. Create a nationwide needs-based model and incentivize provinces to buy in. Penalize those who don't meet a minimum standard of care. Cut out the gatekeepers, the red tape, and the years-long waiting lists, and get to the families the help that they need now. Not in another 20 years. Start treating the autism community like a part of society and not like second-class citizens. Everyone deserves the type of opportunity that Zach has had. It's time to do better, Canada. National Autism Strategy and Medicare for Autism now. Thank you for your time. Thank you.
That was great. Thank you. Andrea.
So we're open for any questions, if there are any. Okay. Going once, going twice, going 3 times, sold. Thank you.